Next, let's discuss what shoulder dystocia is. Shoulder dystocia occurs when the fetal anterior shoulder becomes impacted behind the maternal pubic symphysis during delivery, impeding the birth process. This condition is an obstetric emergency due to the potential for severe fetal and maternal complications. Risk factors include fetal macrosomia, often associated with gestational diabetes, maternal obesity, and excessive pregnancy weight gain. The pathophysiology involves the mechanical obstruction of the fetal shoulders within the maternal pelvis, making it challenging to deliver the shoulders with routine obstetric maneuvers. Clinically, shoulder dystocia is often identified during delivery when the fetal head retracts against the perineum after emerging, known as the turtle sign. This retraction signifies that the shoulders are stuck. Other warning signs include prolonged labour stages, particularly the second stage. The condition can result in significant neonatal complications, including brachial plexus injuries, clavicular fractures, and hypoxic encephalopathy. For the mother, risks include severe perineal lacerations and postpartum hemorrhage. Diagnosing shoulder dystocia involves recognizing the signs during delivery. No specific prenatal tests predict shoulder dystocia accurately, but risk assessment includes evaluating factors like fetal size and maternal diabetes. During labour, an experienced clinician should monitor for the turtle sign and prolonged second-stage labour. Once suspected, the immediate focus shifts to managing the condition effectively to prevent complications. Management of shoulder dystocia requires a series of coordinated manoeuvres. Initially, the McRoberts manoeuvre, which involves flexing the mother's hips back against her abdomen, combined with suprapubic pressure, can often resolve the obstruction. If these initial steps fail, additional maneuvers include delivering the posterior arm, rotating the posterior shoulder with the wood screw maneuver, or applying the Rubin maneuver to adduct the posterior shoulder. In extreme cases, repositioning the mother on all fours or performing the Zavanelli maneuver, which involves replacing the fetal head into the pelvis for caesarean delivery, may be necessary. Each technique aims to dislodge the shoulder or reorient the fetus to facilitate delivery. Let's consider a case study to illustrate the management of shoulder dystocia. A 32-year-old woman with gestational diabetes presents at 39 weeks gestation. During labour, after the head delivers, the fetal shoulders become stuck, exhibiting the turtle sign. The medical team promptly initiates the McRoberts manoeuvre and applies suprapubic pressure, but the shoulders remain impacted. Moving to the next steps, they deliver the posterior arm, successfully resolving the dystocia and allowing the baby to be born without further complications. Post-delivery, the baby is monitored for brachial plexus injury, and the mother is assessed for any perineal lacerations and postpartum hemorrhage. In summary, shoulder dystocia is a critical condition requiring immediate and effective intervention to prevent serious complications. Early recognition, prompt management using the McRoberts maneuver, and subsequent techniques are essential for a positive outcome. We encourage you to review this material thoroughly, engage with the pre- and post-podcast quizzes, and utilize the Anki flashcards for a comprehensive understanding. Thanks for listening to Med Madness. Stay tuned for more episodes where we break down complex medical topics to support your journey in the medical field. In summary, shoulder dystocia is a critical condition requiring immediate and effective intervention to prevent serious complications. Early recognition, prompt management using the McRoberts maneuver, and subsequent techniques are essential for a positive outcome. We encourage you to review this material thoroughly, engage with the pre- and post-podcast quizzes, and utilize the Anki flashcards for a comprehensive understanding. Thanks for listening to Med Madness. Stay tuned for more episodes where we break down complex medical topics to support your journey in the medical field.